Hello guys, this is a complete demo for modality exam. Please copy me and practice several times and you will pass your exam. I have this area for the patient and this area for my clean field. I don't have any another table that use here. Usually patient is at the back here. So I will enter the room. When I'm entering the room, a photographer comes and take a photo of my ID number. So let's get started. Set up your sharps. I'm ensuring that the sharp container is in the safe distance from the patient. Set up your waist. And also I'm ensuring that the waist container is in the safe distance from the patient and clean field. And this is my Benadryl bag in case of blood soaked cotton balls or gloves. I will use this. Set up your clean field. I wash my hands, wear utility gloves, wash and sanitize with low-level disinfectant in the surface area, dry it and put the gloves in the waist. As I have lesion on my hands, I will use gloves for all these three procedures. So I wash my hand, wear gloves. The clean field, my clean field is sterile, so I'm going to ensure just touching the sides so that the central area remains intact. Consult your sheet. So for this first step, acupuncture with tonifying on GB20, I need 1 needle. Avoid spinal cord. Step 2, moxa on UB24. UB24, 1.5 chun needle. Step 3, fire cupping. UB25, I need 1.5 chun needle. Consult your sheet and at least open 1 needle for each step. I'm ensuring that not compromising the clean field. Open at least 3 alcohol swab. And careful not touching the alcohol swab and just touching its cover. And also I am careful not touching the alcohol swab. I touch it. So again, I'm careful not touching the, okay. I'm careful not touching the alcohol swab, just its cover. Put some cotton balls. The cotton balls are sterile and I'm going to ensure that not compromising the clean field, and also the cotton balls doesn't touch the sides of the. Please proceed with first step. First step is tonifying method on GB20. I let my patient know the risk associated with these all three procedures, and I obtain a signed informed consent. I wash my hand, wear gloves. The patient is ready for treatment. I inspect the site for any, inspect the skin for any lesions or contraindication. Palpate the skin to identify the point. Wash my hand, wear gloves. I'm ensuring just touching the sides of the cover. So point is GB20 according to Deadman. This point is perpendicular, slightly inferior. No deep drilling at this point. Avoid spinal cord or medulla. So, or towards the noise. For tonifying method, I ask patient to breathe out. Breathe out, and also turn it clockwise as a second method of tonification. Remove the needle. I wash my hand and wear gloves. I close the port right away as a third method of tonification, and keep it at least for 30 seconds. Inspect the skin for any bleeding or hematoma. It is good, I can discard. Please proceed with the second step. Second step is Moxa and UB24. I wash my hand and wear gloves. My patient, I already have informed consent. Patient is ready for treatment. I inspect the skin for any lesions or contraindication. Palpate the skin to identify the point. Wash my hands, wear gloves. I'm ensuring just touching the inside cover. So this point, according to Deadman, is perpendicular up to 1.5 tune. So there is no specific cautious or contradiction at this point. I get dirty. So for Moxa, I get my stuff. The heat shield is sanitized. However, I'm going to ensure it doesn't touch the shaft of needle, and also I'm not touching the skin. Also, I'm going to ensure that I'm not touching the shaft of the needle. I ignite the incense, sniff it. Ignite the moxa. Put it nicely and extinguish it away from the patient. Put it away from my clean field. I stay beside my patient till the cone bears 3/4 of the way down, or patient is hot. Then I remove the moxa cautiously. Remove the moxa. I'm cautious, not touching the shaft of needle. And I'm careful the shield doesn't touch the shaft of needle. The needle is hot, and I'm going to use forceps to remove it. So I wash my hand and wear gloves. I inspect the scene for any bleeding or hematoma. If it is good, I can discard. Proceed with third step. Third step is fire cupping on the UB25. So I wash my hand, wear gloves. I already have informed consent, patient ready for treatment. I inspect the skin for any lesions, contraindication, palpate the skin to identify the points, wash my hand, wear gloves. I'm ensuring not compromising the clean field. And ensuring just touching inside the cover. The current guideline UB25 is perpendicular up to 1.5 chun. There is no specific contraindication at this point. I get dirty. This is my 99% alcohol swab pre-soaked cotton ball, and this cup is trial, and I'm checking the rim for any cracks or defects. It is intact. I'm ensuring not compromising the clean field. The second cup also is trial. I'm checking the rims for any cracks or defects. It is intact. Also, I'm going to ensure not compromising the clean field. Okay. I'm ensuring the flame is away from the patients. Checking for suction. Suction is good. I stay beside the patient, and if patient feels uncomfortable, I will adjust or remove the cup. Remove the cup. I wash my hand, wear gloves. I will put the cup in the plastic bag to sanitize again. Remove the needle. I wash my hand, wear gloves. Inspect the skin for any bleeding or hematoma. It is okay. I can discard. The station is done. So hopefully you guys, you can by practicing and memorizing it a lot, so you can do it the same as I did, so and pass your exam. Best of luck for you. Good luck.